Hello, hi, hi. Today, on the occasion of AIDS Day, we have a very special guest, Dr. Amit Dravid. He'll be talking to us about AIDS, how we can work with it, and the stigma around it, and all of it. So, welcome. Thank you so much for joining midday for our special Facebook Live.
Thank you, Savni. Thank you, Midday. I am Dr. Amit Dravid, consultant infectious diseases at Ruby Hall Clinic, Pune Hospital, and Noble Hospital, Pune. And I am privileged to join you for this World AIDS Day talk.
Thank you so much. It's our honor, literally. So let's start with
Yeah.
why December 1st is considered as the AIDS Day.
Yeah. See, Savni, you know that AIDS was first reported in the US in 1981, and since then now it has been 40 years. So we are almost 4 decades of fighting on this for this pandemic. And since it was reported first in US in the San Francisco area, there were researchers who thought that we need to create awareness, we need to bring more people in this fight against AIDS, and they found that the time after the US presidential elections and before the Christmas holidays was the time best suited for creating awareness about this pandemic. And that's
Mhm.
why, because their holidays start after 15th December and their
Right.
presidential elections end after 10th of November, so they said, let's have this day, 1st of December, which was
Mhm.
then given approval by the UN agencies, WHO, and since 1988, 1st of December is celebrated worldwide as World AIDS Day. So it is only one of the 12 days related to diseases which are celebrated by researchers, scientists, and all government agencies worldwide.
Okay. Okay, that is interesting. Okay, so can you put a light on how the AIDS is contracted? I know there's a stigma about it. People treat AIDS patients really badly. So can you
Yeah.
just shed some light about it?
Yeah. So, as of now, there is a difference between contracting HIV and developing AIDS. So, when we say we have contracted HIV, that is the virus which enters your body. So, it
Mm-hmm.
enters your body through three mechanisms only. One is you if you have unprotected sexual intercourse with an HIV positive man or a woman.
Mm-hmm.
Secondly, if you get transfused with blood from an HIV positive person, or it can get transmitted from an HIV positive mother to her baby during pregnancy or during delivery. So, since last 40 years, these are the three main modes of transmission of HIV. Once you get HIV, it is there in your body at a very low dormant rate of almost 8 to 10 years. So once you contract HIV for 8 to 10 years, you will have nothing. So you'll have no symptoms, you'll just walk around, have, or you can work as much as you want. That is called a window period. And unfortunately for HIV, this window period is almost 10 years sometimes even longer, around 15 years. So many people tell me that I was fine for the last 8 to 10 years. During those 8 to 10 years, that virus is chipping away at your immunity, which we call as CD4 cells. And once the
Okay.
immunity falls below a certain level, that is, once your CD4 count goes below 200, that is the time you develop AIDS, and that is the time you develop symptoms, and that is the time person falls sick. So there is a clear difference. You contract HIV, you develop AIDS 8 to 10 years later, and AIDS is the last stage of contracting HIV. There are multiple stages in the next 8 to 10 years.
Right.
That is how it goes. But the modes of transmission are the same: unprotected sexual intercourse, blood transfusion, or from mother to baby during pregnancy or delivery. Only three modes.
Okay, okay. But then do you the as we know we are fighting COVID, do you
Yeah,
think HIV patients are more prone to COVID or other way around? I
that's
mean,
a very good question. Now
yeah.
there have been studies worldwide which have clearly told us that HIV positive patients are at a higher risk of contracting COVID-19. almost 30 to 50% higher risk,
Oh my God.
especially those who are not on treatment, or
Mm-hmm.
especially those whose CD4 count is very, very low, are at higher risk, not just of contracting, but also developing severe COVID disease, landing up in the ICU, landing up on the ventilator, and dying. So, HIV infection per se is definitely a risk factor for contracting COVID, and also a risk factor for contracting severe COVID and dying because of COVID.
Okay. Okay. So what do you think? What things we should keep in our mind, like a precaution, basic precaution? Obviously, the contraction
Yeah.
mediums we can avoid, but other than that, do you think for immunity building, what else can we do in our daily routine?
Uh, Basic, now we already know the modes of transmission of HIV. So,
Mm-hmm.
we what I would try to tell the society, especially the youngsters, because there is a lot of myths about HIV amongst youngsters, young
Right.
population, which is now crossing the age of 18, becoming sexually active. So, what I would always tell them is whenever, first of all, be loyal to one partner. It's always better to be loyal to one partner. Try to avoid sexual intercourse with multiple partners. If you have sexual intercourse, use condoms. There is still a lot of stigma associated with using condoms, practicing safe sex, and we keep on harping about safe sex practices, especially for youngsters, because the risk taking behavior amongst youngsters is pretty high. With the advent of 4G, 5G, and internet, there are a lot of myths being spread around, but the basic thing remains the same. Use
Mm-hmm.
protection every time you have sexual intercourse. Try to stick to one partner. It is
Mm-hmm.
always better that way. And suppose if there is a break in the protection, then you meet a
Mm-hmm.
doctor. There are now pills available which we can
Right.
give you to prevent sexual transmission.
Right.
Secondly, when you go and donate blood, during
Mm-hmm.
blood donation camps, proactively ask the person who collected your blood about your HIV status. They will tell you about it. Not just HIV, they will tell you about your hepatitis B status, your hepatitis C
Right.
status. You will come to know whether inadvertently you have got HIV infection as well. Thirdly, if you are pregnant and you are meeting your gynecologist, go ahead and ask him to get yourself tested for HIV. Anyway, gynecologists are now testing people for HIV, testing pregnant women for HIV. But if not, go ahead and test yourself for HIV so that you can protect your baby per se. There are now
Mm-hmm.
kits available which a pregnant mother can take to protect her baby. So this is the thing which we would like to bring to the notice. Secondly, now India has also decriminalized gay sex, decriminalized same sex, same gender sex. So the risk of HIV amongst the LGBTQ community is very, very high, because
Mm-hmm.
there were this community was stigmatized up till now. They were looked down under, because of which their demands, which were really rational, were pushed under the
Mm-hmm.
carpet. But now it has been legalized. High Court and Supreme Court has given it a legal sanction. So remember that LGBTQ community, friends of ours, are at high risk of HIV. We should spread safe sex messages towards them. We should encourage them to get tested if there is a breach in safe sex practices. And I would tell the LGBTQ community that I think time has come where they have to get themselves tested for HIV on a regular basis, say once every 6 months, once every 12 months, because as compared to heterosexual sex, homosexual sex does have a higher risk of HIV, like it or not.
Oh.
So there has to be an awareness amongst that community that now you have got legal sanction. Let us come forward. Let us get tested for HIV. We will try to identify the real extent of the epidemic in that community. So these are the
Right.
marginalized communities which really need to be tapped into. Not just LGBTQ community, the commercial sex worker community, or the single male migrant community, or the truck driver community, which are at very,
Mm-hmm.
very high risk of HIV. We need to
Right.
create awareness amongst them about safe sex and regular
Mm-hmm.
testing for HIV, which will help us really identify the epidemic. How much it is
Right.
spread in India, we will be able to identify.
Perfect. Yeah, the awareness is very, very important for us.
Absolutely.
Okay, can you explain us the terms U equal to U and 90 90 90? regarding HIV epidemic in India today?
Yeah. So these two terminologies were given by UNAIDS, that is the United Nations Agency for AIDS. What is U
Mm-hmm.
is equal to U? U is equal to U is undetectable is equal to untransmittable. That means now drugs are available, what we call as highly active antiretroviral therapy or HART, which is now available for HIV. It is so potent that it will suppress the viral load of HIV in your body to
Mm-hmm.
undetectable level. That means it will be so low that the machine will not be able to detect virus in your body. Once that is achieved, then you
Mm-hmm.
cannot transmit this virus sexually to a person whom you are having regular sexual intercourse with, even without condoms. So
Okay.
that doesn't mean that you practice unprotected sexual intercourse. That still means that you keep on using condoms. But even if there is a breach in the condom, because you are undetectable, your viral load is undetectable, you cannot transmit it sexually to the next person. That is what we mean by U is equal to U. Once your viral load in your body is undetectable, you are incapable of transmitting the virus sexually to your partner, which is a good
Oh,
thing. That is what we
right.
want to achieve. So tomorrow,
Mm.
if I am HIV positive, I cannot transmit it to my wife if I take the pills regularly and my viral load is undetectable. So that
Yeah.
is the meaning of U is equal to U. Now, what is 90-90-90? This is the
Mm-hmm.
target again given by UNAIDS and WHO to every country about their
Okay.
HIV pandemic. So what does
Right.
90-90-90 mean? That every country has to
Mm-hmm.
identify 90% of its HIV epidemic. So government of India says there are around 24 to 25 lakh HIV positive people in India today. Then we have to identify at least 90% of them. We were supposed to identify 90% of them by 2020. We have already missed that target. We could
Right.
identify only 75% of those.
Oh,
So there is still a
okay.
shortfall of 15%. Once
Mm-hmm.
you identify 90% of these people, out of these 90% have to be started on treatment immediately,
Right.
and out of these 90, the third 90 is, out of these 90% should be virologically suppressed. That means what I was talking about, viral load needs to be
Yeah.
undetected, because we want to
Mm-hmm.
achieve U is equal to U. So if you
Right.
identify 90% of your total HIV positive population,
Mm-hmm.
out of that 90% goes on treatment, out of that 90% is suppressed. If we
Okay.
achieve that, then in
Mm.
the next 10 years, we will be able to reduce HIV infections to such a low level that the AIDS epidemic will be more or less over. That
Oh,
means we
oh,
will have no new, we will have negligible new HIV infections, which we will have
right.
negligible AIDS related deaths, and there will be negligible discrimination on that because of that. So
Right.
90-90-90 is the target given to every country to
Mm.
end AIDS, so that that country can end the AIDS epidemic in that country by 2030.
Okay.
But the reality is we are able to identify only 75% of
So,
our epidemic,
mm.
and only 56% of our people are virologically suppressed. So we have to
Right.
go from 75 to 90 in the first 90, and in the third 90
Mm.
we have to go from 56 to 90.
50.
It's
Oh
a
my.
long way ahead.
Long way.
So but that is the target given, and once you reach 90, the targets will change to 95, 95, 95. That will be
Right.
the real
Right.
end. So
Okay.
we are on a journey. Every country is
Mm-hmm.
on a separate journey. Right now,
Right.
90-90-90 has been achieved, I think, only by two countries, the United
Okay.
Kingdom and Switzerland.
Mm-hmm.
But we can aspire to become those countries. So if we really want to end the AIDS epidemic by 2030.
Right. Wow. Okay. Thank you so much. It's so much of.
Yeah.
Okay. I am gonna ask a very, very lame language, simple
Yeah, yeah.
question. Can an HIV positive person marry?
Yeah.
Is it okay?
So, yeah. So now with the decriminalization of same-sex marriages,
Mm-hmm.
the Supreme Court of India has also laid out clear-cut guidelines about whether an HIV positive person can marry or no. So
Mm-hmm.
it is very clear now that if you are knowing that you are HIV positive prior to marriage, then it is a legal binding on you to tell your partner that you are HIV positive before
Okay.
marriage. because you know it, you know your status before marriage, so it is legally binding on you to go and tell
Right.
your partner that I am HIV positive. Now, do you want to marry me or no? If the
Mm.
partner says no, it's fine, then the
Right.
marriage will get nullified. If the partner says yes, that I agree that although you are HIV positive, I am willing to marry you, you can go ahead and marry, but not before informing your partner.
Right.
That is one
Okay.
thing. Second thing,
Mm.
if you lie and
Mm.
you marry that way, then there will be legal repercussions and you can be prosecuted under the law, because you are putting another person's life in danger. You are
Mhm.
exposing that person to a very bad virus and
Right.
unknowingly transmitting it to that person sexually. That is number two. Number
Okay.
three is, now there are marriage bureaus about HIV positive people coming up all over India
Oh.
through the government free ART centers, and now even certain marriage websites have specific
Mhm.
column about HIV positive marriages. So
Oh.
there, the boy is HIV positive, the girl is HIV positive, they both
Mhm.
meet, they decide to marry, then there is no problem. Both the partners
Right.
should just take antiretroviral therapy, be on
Mm.
treatment lifelong. As I said, this disease does not have a cure. There won't be a cure at
Mhm.
least till 2030. So we encourage both the partners to be on treatment lifelong. Yes, they can go ahead if both the partners are positive, both are willing to get married, they can go ahead and marry. That is not a problem.
Okay. Okay. That is great. That is great. Uh, okay. So I think this is our last question. So what do you think? Where do you see India in next 10 years when it comes to HIV and AIDS? Do you think we are progressing? Are we going to the 1990? Are we in the right path at least?
No, we are on the right path. There is no
Right.
doubt about it, because new infections in India have dropped by 35% in the last 10 years.
Right.
So now we are reporting around 70,000 HIV cases a year,
Mhm.
which was more than 1 lakh in 2010. So because of awareness, because of safe sex messages, the transmission of HIV has decreased. The incidence of HIV infections has reduced in India.
Right.
Secondly, the death rate because of HIV has gone down drastically by almost 80% in the last decade, because now
Okay.
such good drugs are available that this
Right.
disease has been transformed into a chronic manageable illness, just like
Mhm.
diabetes. So I always tell my people that if you are HIV positive, say at 20 years of age, and you are going to start the tablets, these tablets are available, some of them are available free in the government ART centers. They are available
Oh.
at very cheap rates in the private sector. So it's not a very
Mhm.
costly treatment. It's a triple drug combination in one pill, just one pill you have to take. But you have to take
Mhm.
it lifelong. If you take it lifelong, don't take any gaps in treatment, then I can guarantee people that they will survive decades, not years. So I can
Mm.
increase their lifespan by almost 30, 40, 50 years, depending
Wow.
on how regular their treatment is. So we have reached a stage where if you take treatment regularly, follow up regularly, do your tests regularly, then it is impossible that you will die because of HIV. That is very clear. So it is not a killer anymore. It's a chronic manageable illness. Now there are provisions that you can marry, you can have
Mm.
kids. We can take a
Oh.
guarantee that if we take treatment during pregnancy, the progeny will be HIV negative. So an HIV positive woman taking treatment during pregnancy can give birth to an HIV negative child. Then there
Wow.
are artificial reproduction techniques. There is a normal
Right.
lifespan. You will grow old with HIV. Now we are talking about growing old with HIV. Because we
Right.
have so many people who are 65, 70, 75 years of age are HIV positive. They are growing old because they are not dying
Mhm.
because of the disease anymore. So
Right.
the overall scenario is much, much more positive than it was in
Mm.
2010.
Right.
Hopefully the next 10 years will be the
Mm.
decade where we end this pandemic. And how we can end it, we already told you, by 90
Yeah.
90 90, achieving 90 90 90 or 95 95 95. We are
Yeah.
still on that path, we are on the right track, but what I feel is the pace is slow. The pace
Hmm.
with which we are getting there is slow. We need to increase the pace. We need to
Work
reach
on
there
it.
much faster. Cities like London have reached there. I'm sure cities like Mumbai will reach there one day, but I would be happy if it reaches in 2025 rather than
Correct.
2030, because Mumbai
Right.
is our economic capital finally.
True. On that very positive note, I think we can end our session. Thank you so much,
So thank
Amit
you so much.
sir. It was really nice having you, and
Thank you.
we hope this awareness helped us, others, and we see better results super soon. Thank you so much, sir. Thank you
Thank
for
you.
joining us.
Thank you. Bye.
Thank you.